Hello, Assalamualaikum. Hopefully this will be the final and last part of types of drug therapy. Following this, we have discussed before about drug dependence. Following this, I will be discussing on compulsion and addiction. Okay. So, what is compulsion? Compulsion is used to describe the intense urge to do something, which can sometimes lead to a behavior, but does not always. And compulsions are small but important part of the addictive process. So it is a part of addiction and are also a major part of obsessive compulsive disorder. So how are addiction and compulsion related? As an addiction develops, it begins to involve the desire or compulsion to take an addictive substance such as alcohol or heroin or to carry out an addictive behavior such as gambling or sex, but it also involves other processes. So addictions, World Health Organization defines a behavioral pattern of drug use characterized by overwhelming involvement with the use of a drug, compulsive use, the securing of the supply, and a high tendency to relapse after withdrawal. And addiction is viewed as an extreme on a continuum of drug use patterns. It refers in a quantitative rather than a qualitative sense to the degree to which drug use pervades the total life activity of the user and to the range of circumstances in which drug use controls his or her behavior. And compulsive and repeated use of increasing amounts of drugs with the appearance of withdrawal symptoms when drug use ceases. Okay, see, compulsive and repeated use of increasing amount of drugs. Okay, and this may be caused by psychology, means trauma from physical abuse, neglect, or chaos in the home leading to stress, which is self-medicated, or it can be due to depression, lack of friend, poor performance at school or work, or poor stress coping skills. And it can be due to environment seen as permissible in a neighborhood, where it can be due to a parental oversight. It can be due to in sports performance or peer group, low socio-economy, gender and ethnicity, whereby neighborhood will talk about all these things and this causes stress to us. So that can lead to a form of addiction in the form of we take drugs to avoid these problems. And genetic involves multiple gene sequences and science, which has not yet been able to pinpoint all the genes involved in addiction. So there are possible multiple gene sequences involved. Okay, signs and symptoms of addiction are chills, sweat, flu-like symptoms, excess amounts of physical energy, nervousness, anxiety, delusions of grandeur, thinking that you're a possible prime minister, yeah, so thinking you're somebody great, okay, or mood swings or euphoria, you feel happy all the time. And types of drug addiction can include cocaine addiction, which is a form of opium, heroin addiction, which is also opium, prescription drug addiction, which includes addiction to Vicodin and oxycontin, which is a drug used for painkillers, or it can be a crystal meth addiction, all right, or it can be a Percocet addiction or marijuana addiction. Difference between dependence and addiction. Addiction refers to a condition where an individual cannot resist the powerful urge to consume the substance. This can be both biological as well as psychological. However, dependence is the need for drugs for physical well-being. So that is dependence. So it is for physical well-being. In this sense, while addiction can be psychological, dependence is merely physical. Okay, and the main difference is that while dependence has the intention of improving the condition of the individual, in addiction it is the contrary, where the individual only reaches a higher level of self-harm. And now, just now we discussed between difference between dependence and addiction. Now we'll discuss between addiction and compulsion. So there are two main differences between addiction and compulsion. It is, for example, pleasure. A compulsion, at least as it is experienced in obsessive compulsive disorder, does not include the experience of pleasure, whereas an addiction does. While people who have addiction suffer all manner of discomfort, the desire to use the substance or engage in the behavior is based on the expectation that it will be pleasurable. That is for addiction. Okay, and the reality, when people have obsessive compulsive disorder, they are usually aware that their obsession is not real. And in contrast, people with addictions are often quite detached from the senselessness of their actions, feeling that they are just having a good time and that other concerns aren't that important. And this is often known as denial because the addicted person denies that his use or behavior is a problem. Often it is not until a major consequence occurs, such as spouse leaving, a drunk driving accident, or a job loss, that they are faced with the reality of their addiction. So lastly, we'll talk about drug toxicity. So what is drug toxicity? I think this will be explained more by Prof. Sharida. So I'll just touch one slide on drug toxicity. So these medications are more pronounced at toxic levels and side effects may be severe. Dose is too high or it may result when the liver or kidneys are unable to remove the drug from the bloodstream, causing a high concentration of plasma concentration of the drug, causing possible drug toxicity or side effects. And symptoms of drug toxicity, it depends on the drug taken. For example, you can have symptoms of hallucinogens, especially when you take drugs which has a CNS euphoric aspects, or symptoms of narcotics, maybe due to a narcotic drug such as sedation, or symptoms of sedatives, which causes sedation, like I said before, and symptoms of stimulants, which actively stimulates the brain. So these are some of the drugs which can cause toxicity. Okay, I guess that ends our lecture on types of drug therapy. And I have prepared a few questions, multiple choice questions, 10 questions if I'm not mistaken for the quiz. Kindly look it up and answer all the questions. And I hope you understand my lecture. And I guess that ends our session and good luck for your final CA for GNBP. Okay, take care. Bye.